There are things that you can do safely before we actually have that image in hand. And myself, as a physical therapist, I actually take very little stock in what that image says. Not that it's not important, but really it's just one little piece of the puzzle, and there's so much that you can be doing in the meantime. Hey everybody, welcome back to the Unchoreographed Podcast. I'm your host, Dr. Jenna Lower, and if you're new around here, I am a physical therapist who specializes in helping people with chronic hip injuries that nobody else can seem to help resolve. Today, I want to dive in and talk to you about one of my most despised phrases that I hear surrounding getting help for hip injuries, and that is, I'm going to wait until I get my MRI results to start. So I want to talk to you a little bit about why this is not the greatest strategy and maybe what you can do instead that would be a little bit more beneficial to your healing. But the reality is I hear this almost every single day from people, whether they seek me out online or they're trying to come into the clinic to work with me. We go to schedule that first visit or discovery call, and people know that they want to get help, but they're hesitant to begin until they've either had their image done or until they get the results back. And while I understand the thought behind this, I want to challenge you that maybe that isn't the best path forward. And maybe there's a more efficient way that you can actually be getting help instead of just sitting in pain while you're waiting around for that image or for those results. The reality is that waiting in itself, is a decision that you're making. And it's often a decision that is keeping you stuck in pain for longer than you need to be in pain for. I think a lot of times we just assume that we need to have that image or that picture that solidifies, okay, this is what's happening in my hip and this is what I need to do moving forward. But really, you're waiting. All you're doing is prolonging being able to get relief, because for a physical therapist to be able to start helping you, or a trainer or a chiropractor or anybody that you're really working with, there are things that you can do safely before we actually have that image in hand. And myself, as a physical therapist, I actually take very little stock in what that image says. Not that it's not important. I think once I'm done with this conversation with you guys, you will understand why I don't put all my eggs in one basket when we're dealing with imaging. But really, it's just one little piece of the puzzle, and there's so much that you can be doing in the meantime. So when you are sitting and you are waiting on that appointment to get the MRI, or you're waiting on the appointment with the doctor to get the results, all of a sudden, all this time has passed, right? Like you figure you have an injury, you wait for the appointment for ortho. And then, maybe a couple of weeks has passed. And then you have to wait because they're going to schedule you for an MRI. And maybe they do it immediate, or maybe you have to schedule it and now a couple more weeks has passed. And then you have to schedule another visit with the doctor, which another couple of weeks is going to pass so that you can actually get the results. And then if you're lucky, they're going to refer you to physical therapy or whatever their plan is going to be for you. And now I have to wait a few more weeks before I actually start. So when you go that route, sometimes we're looking at 4-8 weeks before you're actually doing something about your hip. In all actuality, you can start day one. The moment that you start to feel issues, there is something safe that you can do. You just need to be assessed and evaluated to figure out what that is. And now I can get help on day one while you are awaiting the MRI or the results, and you're hopefully getting some pain relief in the meantime, versus waiting 8 weeks to even feel any sort of changes. That's huge. That's a huge difference in time that you're spent just sitting around, twiddling your thumbs, trying to figure out, oh, this is so frustrating. I can't figure out how to get out of pain. Rest isn't working. Ice isn't working. Well, of course, those things aren't working. You haven't addressed the movement at all. So it is extremely important to understand that waiting is not the solution. And there's so much that you can kind of do in the meantime. I think also from a mental perspective, it often sort of creates a little bit more mental anxiety when you are just sitting waiting around for answers. it sometimes you go into a spiral. You start down that Google rabbit hole at 2 o'clock in the morning, trying to self-diagnose, or you kind of anticipate the worst. And that can be really anxiety provoking too. So from a mental side, I think it's important to also be seeking help earlier from a licensed professional or somebody that really knows what they're doing that can safely start you early on. So let's talk a little bit about what an MRI or an image really is and what it isn't. So in short, when they take the MRI, they are getting a picture of structure. So if you are struggling with hip pain and they're suspecting that maybe you have something like a labral tear or an impingement or a stress fracture or any of these types of structural issues, they're going to want, usually the ortho is the first thing that they're going to do. Well, I guess the first thing they're going to do is hopefully, they're going to do a little bit of an assessment. And then they're probably going to say, okay, I can't really tell what's happening from the outside, so we're going to send you in for an MRI or maybe an X-ray. Sometimes you have to do an X-ray before the insurance will even approve an MRI. So they're going to take this image so that they can see structurally what is happening on the inside of that joint. And that's all well and good. But the problem is an MRI is only one piece of the puzzle. It only takes into account your structure. What it does not take into account is how does your pain change or evolve with movement? How are you moving? What are your movement patterns that you are using that maybe is contributing to that tear or the compression that's happening in the joint? How are you stabilizing during movement or at rest? What is your nervous system like? Are you under a lot of stress and high tension and that nervous system is sort of in fight or flight, or is it calm and relaxed? What is your capacity and your load tolerance for movement and for weight and for everyday life or athletics or whatever it is that you're doing? It doesn't look at any of that. It literally only looks at what is your structure. And if we only look at structure and we only pay attention to what that image says, you are missing a huge piece of what is actually going on in your hip. Movement is extremely important. And the thing with going to an orthopedist, which not downplaying their role, it is extremely important to see an ortho in certain situations, and you should absolutely do that. However, the orthopedist isn't even really going to look at your movement. They're going to look at your structure. And then if they feel like there's nothing wrong with that structure, they're probably going to say, okay, let's either give you a cortisone injection or let's go to physical therapy. And then the physical therapist is going to start this process anyways. If they do see something on the structure, they're probably going to give you similar options. You can have an injection, you can start some physical therapy, or we can have surgery. And the reality is, all of those options are, well, maybe not all of them. Physical therapy, I would say, is a huge option, but surgery or an injection is not going to address how you're moving. So if you can go in and work with a physical therapist or somebody who really understands the hip and specializes in this, they're going to be able to assess what your movement is and see what's physically happening just on a day-to-day basis. And these are going to be things that the orthopedic doctor very likely isn't even going to pick up on because that's just not their specialty, and that's okay. A physical therapist, yes, imaging is a piece of what we're looking at, but I feel entirely confident doing an evaluation on somebody or follow-up sessions on somebody who has never had an image done, because we are trained to be able to diagnose and look at movement from the outside to try to get a clearer picture of what might be happening on the inside. Now, I don't have X-ray vision, so I obviously can't see exactly what's happening in there, but I can get a pretty darn good idea based on the tests that we have and the way that you're able to move, what provokes your pain and what makes it feel better. There, of course, are going to be situations where that MRI is going to be needed. You know, maybe you've done PT for a little while and it's not getting better, then, or maybe we really aren't sure what's happening, then of course I'm going to refer for an MRI. But the point that I really want to make here is that you can see a physical therapist long before you ever have that MRI. Chances are it may even make it so that you don't end up having to have the MRI, because maybe in those 4 weeks that you start working together, your pain actually is able to resolve. And now you've just saved a lot of time and a lot of money and a lot of unnecessary pain and struggle by starting early in on that rehab process. The other thing that's really important, I think, is sometimes getting the image and seeing all these big, scary medical terms, medical jargon. It is scary, and it can be a little bit anxiety provoking. And you see these big words like femoroacetabular impingement and grade 2 tear or degeneration, and there's really scary words in there. And nobody ever really explains it to you in layman's terms, especially if you see the report before you ever meet with the doctor or the PA. And that can be really scary. And what ends up happening a lot of the time is we start to create this story or this false narrative based off of what this image has said. And that's a really, really slippery slope, because just because something says that you have arthritis or joint degeneration, that does not immediately equate that you're going to have, it does not equate to having pain or having problems. And it can be a really slippery slope seeing that and not feeling like, oh my gosh, I'm always going to be in pain. I'm destined to be in pain forever because I have arthritis. And it's not your fault. This has sort of been the narrative that we've been fed. Arthritis is bad and joint degeneration is irreversible and things can only be fixed. It's structural, so it can only be fixed with surgery. It's nothing that you're doing wrong. It's just, this is the narrative that we've been fed, and it isn't the whole story. Your image, those big scary words, they don't create your destiny. They don't equate to you are bound to have pain for the rest of your life. There's a whole lot that you can do, even if you have a structural problem or arthritis. And we know this partly because they will do studies all the time where they'll take MRIs, x-rays of the hips, or sometimes they do it of other joints in the body, but they'll take an image of the hip in a population of people who have zero symptoms, no pain, no problems, like they're doing everything they want to do, no restrictions, zero symptoms. They take the image, and 60 to 70% of these people or these images will come back with clinically significant findings. So that might mean labral tears, it might mean impingement, it might mean arthritis, but none of these people have pain. So we know that findings and structural changes, they don't automatically mean that that is where your pain is coming from. And it can be really dangerous to get that MRI. Dangerous isn't a good word. An MRI isn't dangerous, but mentally, emotionally, it can be really tricky to see that something is positive on that image and to not immediately start to go down that dark rabbit hole of, oh my gosh, that's where my pain is coming from and it's never going to get better. Because the reality is we don't really know that that's where the pain is coming from. How many times I've had somebody do an MRI and they find an incidental finding, and really that's not where the problem is coming from at all. I'm sure there are some of you out there who have experienced something similar where, you have a ton of back pain and they go in and they're like, oh, your hip has a labral tear in it. Well, is that where back pain is coming from, or is there something wrong with your back? Or vice versa. Maybe you go in and they find, this is a really common one, they do the image of the pelvis and the low back, and you have hip pain, and they find you have a herniation. And suddenly we're treating your back instead of your hip. And should we treat your back and your hip together? Yes, absolutely. But is your pain coming from the herniation? Maybe, maybe not. But we need to do movement tests and get a feel for how that herniation may or may not be impacting your hip. So we're not just treating a body area that had a positive finding in it just because that's what the image said. It does not equate to that is where your pain or your problem is coming from. And the reality is too, like with herniations, we see that in the vast majority of the population over a certain age. So that is also a really normal finding on an image, as is hip arthritis. We are on our feet all day long. We are weight-bearing, load-bearing joints. Our hips are load-bearing joints. So there's going to be some degeneration there. There's going to be some wear and tear. And that's actually a really common and normal finding. The way that I generally equate arthritis in the hip or anywhere in the body is it's like a wrinkle on your skin, but it is on the inside. It is inevitable. We all have it happen. It does not mean that that's where your pain is coming from. So we don't want to get into this habit of getting an image on everything that hurts and automatically jumping to conclusions that that is the problem, or that it will never get better because this structural finding is there. And I've been doing this for 13, almost 14 years, and I can absolutely tell you with certainty that that is not the case the majority of the time. Certainly sometimes, right? There's always, it's never absolute. But the majority of the time, that MRI is such a small piece of what we actually have to pay attention to. So what do we pay attention to instead? Is the MRI still important? Yes, it is important, but we can often, as I said before, get started before you have that image done. And many times you end up not even really needing the image if your pain is able to resolve itself. So early rehab, or starting some movement, getting an assessment, meeting with a physical therapist before you have that image, the types of things that we are going to look at are, we're going to look at, what is your strength like? What is your range of motion like? What muscle imbalances might be there? How are you moving? And we look at it through everyday functional movements. We have some special tests that we do to try to figure out structurally, is there something happening there? Is there maybe a labrum tear in there? Is there compression? All these types of things. There are some external testing that we can do to get a feel for what's happening on the inside of the joint. Through that, we are able to come up with things that help you feel better. Maybe that looks like some mobility exercises. Maybe it looks like some stability and strength things. Maybe it's some movement re-education. Maybe it's some manual therapy, some soft tissue massage, some cupping, some dry needling. It's going to be different for everybody what the plan is going to be. But moral of the story is, there are safe things that we know how to do, whether or not you have that image. In turn, what is that going to give you? Hopefully, it's going to start you on the path of pain relief, or at least starting to better understand what's happening in your body. It's also going to help hopefully start to reduce some of the inflammation that might be there. We can start to work on some of the instability or the muscle imbalances that might be present that an MRI is not even going to see in the first place. We can start to help you downtrain your nervous system. Maybe you are on a high alert and in that fight or flight state, and you constantly are holding tension through the hips and the pelvic floor. And there are things that we can do as easy as breathing and as safe as breathing that can start to downtrain that and relax it. Even if you're in a lot of pain, there is always a place that we can start. That is exactly what a physical therapist is trained to do. So again, important that you find somebody who knows what they're doing, licensed professional, but also even better if you can find somebody that is specialized in the area of the hip, because they're going to know exactly the process to take you through and some movements that are safe to start with and can actually help get you on that path to pain relief early on. And we can do all of that before we ever know what that MRI says. Now, bonus, if you do have the MRI, or once you get the MRI, we can then compare those MRI findings with the physical examination, the movement examination that we did, and make sure that they line up. So now, if anything, we have a more powerful case for, yes, this is maybe coming from structure because nothing has changed with the things that we've started to implement, or your MRI said you have a structural problem, but you're not in pain anymore and you've been improving and you can do all the things you couldn't do before. Well, now we know, okay, that's probably an incidental finding then. That pain maybe wasn't coming from the labral tear or the arthritis. And it shows you and it builds back that confidence that no matter what that MRI said, that's not your story. You still can get better. Now, on the flip side, if you are not improving with movement, a good physical therapist is not going to keep just taking you through this protocol or this program. They're going to refer you back for imaging. So is there a time when imaging is useful and helpful? Absolutely. Yes, I don't want to give you the impression that we don't ever use imaging. We absolutely have to use imaging, but using it strategically and when it is necessary versus just because, that's where we want to draw the line. A lot of our movement tests and exercises that we do as physical therapists are also very diagnostic in nature. So we can really tell a lot from the outside without ever having that image. But there are certain situations where, like I mentioned, sometimes it doesn't get better. Sometimes, no matter what position or movement I put you in, it's still creating pain. 4 weeks in, if you are not starting to see changes, I am absolutely referring you back to ortho, and we are very likely going to request imaging. I don't want people to just keep going through something that's not working. What I can tell you, though, more often than not, after doing this for as long as I have, is within the period of 4 weeks, usually people are starting to see changes. But there certainly have been cases where people haven't, and their imaging did find something bigger that needed to be addressed surgically. So we are always still paying attention to that. You want to look for any, red flag symptoms. Obviously, if there was like a lot of trauma around how you got hurt, a fall, a car accident, anything like that, trauma, like of course we're going to want that imaging first. We want to make sure that things are stable and safe. If we think that there might be a fracture or something like that, or avascular necrosis, which is like a dying of the femoral head. Again, this comes along with some other symptoms, but absolutely we are referring you for an MRI. If you've tried physical therapy and things haven't helped, or you feel like you've tried a lot of other options, injections, things like that, and it hasn't helped, MRI is a good option. So I don't want to give you the impression that it is irrelevant and we should never use them. We absolutely do need them. The vast majority of people, though, I think when they use the excuse of, I don't want to have my discovery call with you, or I don't want to have my evaluation and get started in this program until I have my MRI, that's where I'm like, well, let's maybe at least do the evaluation, and then we can determine together if it really is something that needs an MRI before we start treatment or not. The very least, you can do the evaluation and figure out, do I need that imaging? And chances are, hopefully, no, there's still safe things that we can start with. The majority of the time, there is something that we can start with. Like I mentioned, it might be as small as breathing while you wait for that MRI. But there is no purpose in just waiting out an image because you think you're supposed to, when all this time is passing and you really are just not getting pain relief in that time. So if there's anything that I would want you guys to take away from today's episode, it's that the longer that you wait to get help, the more the problem is going to grow. And that might be more compensations. It might just be more prolonged pain. It might be more mental and anxiety that is developing. So make sure that you are making a decision based on evidence versus what you think you're supposed to do. If you ever aren't sure, talk to your doctor, talk to your physical therapist, seek out some help and figure out, hey, is this something that you think that I could get evaluated before I have my MRI? I would like to get an MRI, or I'm not sure if I need an MRI, but do you think you can treat me beforehand? And if they gather sort of what your symptoms are, that physical therapist is going to be able to tell you pretty quickly if you really need the MRI or not, or if you can wait a little bit. Definitely make the decision to not just wait. Waiting and holding off is also a decision. And again, as I mentioned at the very beginning of this episode, that's often the decision that is keeping you held in pain for much longer than you need to be. So you are allowed to start. It is good to start. It is helpful to start. And figuring out that image is just one little piece of the puzzle is so important to you realizing the power that you have over your own pain and over your own healing. The diagnosis, the image, does not get to decide or define your future. You get to define it. And so find somebody who will help you with that, who will help guide you through movement that is safe and get you started on a path to pain relief now versus 4 weeks from now. Yes, the MRI might be giving you information, but always remember that movement is what is going to give you momentum, and that is what is going to change things for you long term. So I hope that that was helpful for you guys. If you are somebody out there who has been saying, I'm going to wait till I get my MRI results, I hope that I have persuaded you to maybe seek other alternatives, find somebody who can help you now rather than later, and at least start, at the very least, get that evaluation in from a physical therapist so that they can start to give you some tips, some solutions to put you on that path to pain relief. I hope to see you guys again here next week. Thank you so much for joining me. As always, if you have comments, if you have questions, put them in those comment sections. I can't wait to engage with you guys and chat with you a little bit more. And I will see you back here next week on Unchoreographed.